What are the latest guidelines for statin use in 2023? Are you curious about the latest guidelines for statin use in 2023? Statins are commonly prescribed medications that help lower low-density lipoprotein cholesterol, often referred to as LDL cholesterol. They play a vital role in reducing the risk of atherosclerotic cardiovascular disease. Let's break down the key points from the latest guidelines. First, the guidelines emphasize that statin therapy should be initiated based on a patient's cardiovascular risk, rather than aiming for specific LDL cholesterol targets. This means that healthcare providers will assess how likely a patient is to experience cardiovascular events over the next 10 years. If that risk is 20% or greater, statin therapy is recommended for everyone. In cases of secondary prevention, where patients already have atherosclerotic cardiovascular disease, if LDL cholesterol remains above a certain threshold after starting statins, therapy should be intensified. Specifically, if LDL cholesterol is above 1.8 millimoles per liter, which is about 70 milligrams per deciliter, additional lipid-lowering treatments may be necessary. The guidelines have shifted away from targeting specific LDL cholesterol levels because clinical trials have not definitively established optimal targets. Instead, they focus on thresholds that indicate when to intensify therapy based on evidence showing benefits from lowering LDL cholesterol below those points. For patients who cannot tolerate statins, the recommendation is to continue taking them at the highest dose that can be tolerated, even if it is a low dose. This approach helps maintain some level of cholesterol management without stopping treatment completely. For very high-risk patients, such as those with multiple major cardiovascular events or one event plus several high-risk conditions, the guidelines suggest using the highest tolerated intensity of statins first. If LDL cholesterol remains above 55 milligrams per deciliter despite this therapy, adding non-statin medications like ezetimibe or bempedoic acid is recommended. For adults aged 40 to 75 years with one or more cardiovascular risk factors, such as high cholesterol, diabetes, high blood pressure, or smoking, statin therapy is advised for primary prevention if their 10-year cardiovascular risk is 10% or higher. If the risk is between 7.5% and less than 10%, statin use may be selectively offered. For individuals older than 75 years without existing cardiovascular disease, the evidence is not strong enough to recommend starting statins routinely. Therefore, decisions should be made on a case-by-case basis. Lastly, while newer lipid-lowering agents are emerging, statins remains the cornerstone of therapy for managing cholesterol levels. In practical terms, assessing cardiovascular risk using validated tools is essential for deciding when to start statin therapy. Begin statins in patients at moderate to high risk and use LDL cholesterol thresholds to determine if additional therapy is needed. Monitoring LDL cholesterol levels after starting statins is crucial. If levels remains above the established thresholds, consider adding non-statin agents. Encouraging lifestyle changes alongside medication is also important for optimal cholesterol management. These 2023 guidelines reflected a shift towards personalized treatment based on individual risk factors and LDL cholesterol thresholds, aiming to effectively manage cholesterol and reduce cardiovascular events.